Hello, friends. I'm Dr. Puja Kapoor, consultant pediatric neurologist, Paras Hospital, Gurgaon, director and co-founder Continua Kids. So today we are going to answer. So we from the last session we've got a lot of questions which needs to be answered. So today we'll continue with whatever we left last time, and we would be answering the questions which have been put forward by the parents by the Google form. And before we start, I just would like to request to put your questions in a more elaborate form. By elaborate, I mean that, only by writing my child is having autism spectrum, what to do is not a question because every person has the diagnosis, but what in the diagnosis are we looking forward? So that is what we want so that we would be able to help you in a better way. So I would request again that put your queries in a very elaborate form. We all know that we've got the diagnosis of either autism or ADHD or dyslexia or behavioral concern. But what basically are we looking forward from the question so that we make a very specific answer to help you out? Okay, so without wasting much time, now let us go to the questions. And my first question is from Arzan Patel. So my child is 2.11 months old, and we have a diagnosis of ADHD and mild autism traits. We are on therapies like occupational therapy and ST and under neurologist treatment. The question is that I have read a recent study that mentions metformin to be useful in dealing with autism spectrum like social communication. How much does it help? How to give tablets to such a small child if not to be given with honey? So let us come to the question. So, hi Arzan, and I appreciate the question because it's very clear and straightforward question. So, before we get into, so metformin is basically a medicine which is used for diabetes to control the blood sugar. And recently there's a lot of literature which says that it works on autism spectrum disorder with children with fragile X genetics. You know, the most commonest reason for autism spectrum, the genetic reason for autism spectrum disorder is fragile X syndrome. And they have found out that the way the fragile X genetics happen and metformin can be used in that treatment. And but still this is in the research form, and it is specifically the research is on children with autism spectrum disorder secondary to fragile X syndrome. So nowhere in your question is mentioned that kid's name, that's Arzan, has fragile X or not. So I need to know that also, because yes, now the studies are coming up for metformin use, but again these are studies and still needs to be proven. Second is that it is also used in children with autism spectrum disorder without fragile X, but to counteract the secondary side effect of atypical antipsychotic. You got my point? So, children who have been diagnosed with autism, there are children who have been put on antipsychotic medicines like risperidone, and to counteract that side effect of risperidone, because a lot of our children, when given risperidone, become very obese and also they lose their spatial organization skills in the environment. So to correct that, metformin has been widely studied. So please go for the full thing, that because you have nowhere mentioned any context of Fragile X, and nowhere it's like you are on some an atypical antipsychotic medication. So I would say that metformin use is right now nowhere into the picture for a child who has got just mild autism trait with ADHD. So in fact, I would like to help you out that if there are a lot of ADHD traits and the child is not able to reach the milestones because of ADHD, yes, there are medications for ADHD. Kindly consult and talk to your neurologist that if we could give, because generally ADHD medications are given after 6 years of age, but you can give after three, in talk to your neurologist so that you could get into the situation, could find out and help you out in that. Also, ADHD medication also in the tablet form. It does not have syrup right now in India. So yes, for tablets, we crush the tablet and give it to the child with whatever is feasible, water, honey, or juice, or anything, whatever is feasible. Okay. So I hope I've answered this question. So can we go to the next question, please? Hello. Can we go to the next question, please? Okay. Now, the child name is Ahan, and I'm 3 years old. My diagnosis is autism spectrum disorder. We are on therapies like occupational therapy and speech therapy. The question is, why is Ehan pinching all the time? So, again, I really appreciate the question that it is very specific. So, we just want to know that in spite of taking the therapies, so why is Ehan pinching? So, we see a lot of children who pinch, and we have to find out the cause, that why my child is pinching. So there are n number of reasons. Sometimes because if the child is not verbally expressive, so he wants to just pinch to tell you, okay, that I am agitated, I am gussa with you, I don't like your words, why did you scold me? So for everything there is just pinching. So the other reason could be that just to grab the attention. So one is because I don't have an expressive vocabulary, I'll do the pinching. If I get agitated, I get anxious, I get angry, I really don't like the way you are talking to me, I really don't like the food which has been served to me, I don't like whenever I go in a crowded place. So I only know, I cannot tell ki papa, I don't like crowded places, please don't take me to those places. What I'm going to do is like, I'll just pinch. If I don't like this food, what I just am angry with that why are you feeding me this food? I'll just pinch because I don't have that expression of. So this is one reason. The other could be just to grab the attention. So the child is quickly, I mean, just like sitting down with you, you are busy with your work. Maybe the child would come, Ehan would come and pinch you. So just to grab the attention, that I need your attention. I want you to play with you because you are reading book and you are not paying attention. So just to grab the attention, I could pinch. The third could be the sensory concern, because what happens, they know that by pinching you experience some sort of you give some expression of, like, suppose if Ahan is pinching and you do like this, so he understands that by this procedure you have the grimacing facial expression, and to get that facial expression, maybe he derives pleasure from this, he will start pinching. So to find out the cause, I need to know the history before what all happened for my child to pinch, because the treatment protocol would be different in all the scenarios. If I have the pinching to grab the attention, I'll put in some other behavioral modification. If I have the pinching because I have sensory concerns, I'll put in a different protocol for him. If I do the pinching just to have an expression of myself, I'll have a different protocol for that. So I just saw few minutes back a child who does not have a verbal vocabulary. Verbally, expression was not there, but then he used to type, I am angry, I want to go. For yes, he has started doing this. For no, he used to do this. And the parents experienced a lot of lesser pinching, lesser tantrums, less of behavioral problems once the child knew how to express him. So if his elder sibling was coming and playing with him and he did not like to play, he did like this. So that means I don't want to play right now with me, and that was the expression. Previously, he was just throwing tantrums and all, but now he's become much more settled. The pinching has decreased, his tantrums have decreased. So you have to find out the way, first of all, what's the cause, and accordingly, the solution has to be defined. Okay. So may we have the next question, please? Yeah. So child's name is Ayan Khatri. I am 4 years, 5 month old. My diagnosis is mild autism, and therapies, I'm going on occupational therapy, special education, and speech therapy. The question is, no speech or no bubbling any word is my big concern. Okay, so whenever you send me questions like this, I need to know what is happening before that. So, if for a normal child also, at 18 months, the child would start having few contextual words, maybe four, maybe five, but that is okay with me. But if you see, before 18 months, the child would just analyze all the situations around. The child would start pointing towards the object. The child would understand your command. If I will say, where is your nose? The child would do like this, point towards your eyes, your head, your hair. So he would be able to understand it, and then only the verbal expression comes in. So I really want to know that you are doing wonderful job, that you are giving so much of therapy, but I really want to know whether my child really is in the age that he would speak, because I need to know whether pointing has started or not, whether command following has started or not. Because if those are lagging, my verbal vocabulary would be obviously compromised, and I would go according to what the developmental milestones go for a normal child. I would press a lot of emphasis on pointing towards object. I would press a lot of emphasis on command following, and definitely my verbal things would start coming in. The thing is, they say that all the research, a lot of research says that by the age of 4.5 years, if you have the command following in place, there are very high chances that your expressive verbal vocabulary would develop. And we try till the age of 10 years. So till 10 years there are chances the child would have could speak. So please, Ayan, I really, for Ayan, I need to know about his previous milestones, and if those are not have been achieved, please work on them first. And because those are important, if they will come, definitely there are higher chances of him achieving the verbal expression. Okay. And also, it is said that in one third of the children who are non-verbal till a later age, there are lesser chances for having a verbal speech, verbal expression. And in that children, we go to the other alternative therapies and alternative treatments for the expression rather than just the verbal part of it. Okay, thank you. Can we go to the next question, please? Abhinandan, and I am 3 years old. I have got autism spectrum and I am taking OT and speech. My question is, my baby tantrums are increasing. He improved a lot. I started therapies at home from 18 months for him. He started talking in two phrase word now. Very good. Now he understands my command, but suddenly he has become aggressive. Okay, so what we have seen is like that whenever our children become more better and better in their understanding, the more they start having, that revolt kind of attitude, that why I have been taking to OT sessions and speech sessions, because they believe that we are good. So as a child become more aware of the environmental factors, more acknowledges the thing that what he is put into. So that is the time when they become a bit revolty and they just don't want to go to the therapy sessions. So that could be the one factor. The second factor in your case as a differential could be that could be your child has got a bit of hyperactivity, which is unmasked now after my child's autism spectrum traits are coming down, because we also see a lot of children, once they present, the presenting features could be autism. And as the autism starts clearing off, because you said that now he's taking talking in two phrase words, he's understanding. So what happens in a lot of children, we see that ADHD symptoms starts coming in. They were there before also, but we were unable to pick up because there was a lot of overlap between the sensory concerns and autism features. And once they start settling off, your ADHD features starts showing up. So make sure that you do a consultation with your doctor and sit and tell whether and look for ADHD features. The third reason could be that have you changed something? Maybe the therapist has changed. Maybe something new has changed. His grandparents have gone. His grandparents have come in. Something new in the environment has happened, because I really need to know on what has happened, because these children sometimes show a lot of tantrums and lot of aggression once even their therapist change, or something happens at home, you lose your pet, your helper changes who is very affectionate with the child. So we really have to go to and analyze these three conditions which I have elaborated and find out the cause. Because again, as I said in the previous question, that everything needs a reasoning and to be treated accordingly, based on my diagnosis. So, next question, please. Umesha. So, child's name is Umesha, and I am 3 years old. I am diagnosed with uh, severing, mind disturbance, and senseless. and yes, getting treatment and yours, and also therapy in local. So again, now this type of question, I just don't understand anything out of that, because I don't understand the question at all. What is the diagnosis? There's no diagnosis as shivering, mind disturbed and senseless. Even I am senseless at times. So, and therapies, what therapies are you going in? I need more specific answer to that. And question is, she is improving in action. What are we looking for? So kindly don't put up such those are very loose open questions, and no discussion can be done on these questions. I want more specific questions so that we could discuss those and help other children who are also having the same thing. Okay. So I want the parents of Umesha to be telling me more specific questions. Okay. Thank you. Next question, please. So, kid's name is Preetam Jawali. I'm 4 years old. I'm diagnosed with ADHD and speech delay. I am on ADHD. I'm on Sizodon 1/4, Arkamine 1/4. So these are the two medications which he's on from last 2 years, and speech therapy since last 6 months. Okay. He is hyperactive, he is non-verbal, does not respond to his name, and his hearing is normal. So, uh, for Preetham, I would really like to find out what is the diagnosis. So, looking at my child is has got ADHD, so that means I am hyper. My symptoms are, I've got a speech delay, so that means my language and speech are not age appropriate. He's does not respond to his name. So, what I'm looking forward to is the diagnosis correct? Is not there are other features for autism, because not responding to his name, generally in ADHD, not responding to his name is not a major symptom. I would really ask him for to check the diagnosis and also find out whether other symptomatology of autism like eye contact, command following, pointing towards object is present or not. Because if that is not all present, I think the diagnosis of plain ADHD is not going to help me. There is something added to it. Next is the other differential could be I am hyper and I've got a speech delay. I really am looking forward to whether I'm not dealing with something what is called as intellectual problems. In fact, my what about my cognition part of it? Am I toilet trained? Do I recognize alphabet number colors? Do I have I started walking at 1 year of age? There are other dysmorphism or not. If I know that, then my diagnosis will shift from autism to global developmental delay and cognition problem. And then I would not just only take speech therapy, I would take occupational therapy for hyperactivity. I would put the child to swimming to tame out that hyperactivity. I would stop the screen time. I would stop the sugars and extra carbs and extra empty calories which my child is on, if he is on. And definitely, I would look for occupational therapy also if there are sensory concerns. And if I have just got global developmental delay, I would also go for an ABA therapy. So these are our thought process. This is how we approach to a problem. So for Preetham, I need to know all these things before giving me a conclusive thing for my child. And yes, taking Rizodon and Arkamine, obviously it is started by a doctor and those must be helping. But check upon that maybe we can increase the dose for hyperactivity, because Arkamine 1/4 once a day Risodone 1/4 once at night. If it's not helping, if I still have ADHD, those medication very well can be altered and modified. The dosage could be adjusted to take my child to a better state of affairs. Okay. So, can we have the next question, please? So again, this is again, I won't be able to help this child, Gaurav, because I don't have a diagnosis. I'm not on therapy, and my answer, my thing is just speech delay. So I think I have a whole presentation on difference between what is the differential diagnosis for speech delay, whether this is autism, whether this is expressive speech delay, whether this is social communication disorder, whether this is ADHD, whether this is intellectual problem. So I think for the parents of Gaurav, please go in through that presentation of mine so that you would know what we are dealing with. And so, because once we know the diagnosis, then only we find out what could be the treatment modality for that, because all the differentials which I have told you, starting from autism to intellectual disability, the treatment protocol may vary. Okay, so I want more specific questions rather than this. Thank you. Can we have the next question, please? So, my name is Ayansh. I'm 3 years old. I am diagnosed with autism, and therapy is taking early intervention for 6 months, including OT, speech, and special ed. My question is, he has started going to play school from last 1 month. Okay. He tried to engage with kids and also participate in activities, but it is difficult to engage him at home as he doesn't follow the instruction and do the repetitive things. So, number one, also speaks very less word but sings songs and rhymes on his own, and also having sensory issues. I am a working mother. Please suggest how can I help him to improve with home program, or I should continue both play school and therapies. So the thing is, I've always been telling this, always I've been telling this that what there are three prognosticating markers for my child for whether my child will improve with time or not. The first is that at what age you started with the interventions. Second is like at what is the cognitive ability of the child. So that means whether he has learned up the things, whatever has been taught to him, whether he knows body parts, whether he knows alphabet, whether his cognition is good or not. That defines that. And the third is the sensory concerns. So we have been seeing children who have got sensory concerns, and those are the things which are not letting my child go forward in his development, in his or her development. So we have to take care of these sensory concerns. So, Mama, I understand that you are a working mother. So, I would like you to please learn up, sit with your occupational therapist and talk with him, because I see, because you said that he sings songs and rhymes on his own. So that means he's an auditory seeker. He wants to speak on his own and listen his own word so that he doesn't have to listen to anybody else, and which is not a great thing to happen. So that is auditory sensory phenomena, and really I have to stop this. So just sit with the therapist and ask him or her that how could we make sure that we stop this self talking of his. Because the moment the self talking will stop, you would find him that he is more attentive towards you and his command following has increased. So, whatever little time you have, because you're a working mother, I can understand the time limitations. Just try to focus on OT, so that the lesser the sensory concerns, the better the child would be. Also, can you not ask for help from your family and friends? Now, this is summer vacation time. Ask your sister, your brothers, their children to come to your place, or grandparents. or your family friends and all, so that they could help you out. Because these 3 years and right now I've got sensory concerns, so I'm a bit worried. I would really work hard on my sensory things. And now coming to the next thing is like whether I should start with a play school, continue with the play school. The thing is, play school is a group therapy, and as far as I could sense that this child requires a lot of one is to one also. So can we send a shadow teacher to the school to really make the maximum time from that school? Because schools gives you an environment where there's a lot of children who are there, but I also need to make Ayansh mingle with them. So for that, if I have a shadow teacher who would say, Ayansh, hello bolo, Ayansh, hi bolo, Ayansh, उसको वहां बैठो, Ayansh, चलो color करते हैं. So we would persuade some person who would persuade him to do all the activities and interaction with other children, because for a class teacher to handle and focus on Ayansh would be quite difficult. So if you could arrange for a shadow teacher, that would be fantastic, because that would really help him to get more results in a limited amount of time. Vis a vis, if I am just left into the school and make him do things on his own. So, and similarly for you, I would prefer you to work more on the OT so that the connection establishes, and then the command following will definitely follow. Okay. So, next question, please. Oh, okay. So, so this question is quite similar. Question has been put forward by a few more parents. So, I am 3.1 year old. I don't have a diagnosis, but still I am on OT, speech, ABA, and special education. I would I would really request you to have a diagnosis of, so that somewhere near about we know. Because my thing is how to handle tantrums. Again, I have a whole video which tells you how to handle the situation when the tantrum is happening, how to get to the thing why this tantrum happened, what led to this tantrum, and what to do after the tantrum finishes. So kindly subscribe to the channel and you will find out temper tantrums by Dr. Puja Kapoor. There's a whole video which tells you to analyze the situation, that what led to the causative agent of the tantrum, how to deal when the child is in the tantrum phase, and what to do once the tantrum is over. So, just to get a glimpse of what I've done. So, the tantrum could be because of 100,000 reasons. Maybe you are moving in front of a chocolate shop and he wants to take the chocolate, and you are not giving the chocolate, he may throw a tantrum. So, here the causative agent was that you are not fulfilling his demand, or in front of a toy shop, or blah blah blah, whatever. The second cause could be that you are asking him to do some writing and he's not interested and he can throw a tantrum. The next could be my child has got a lot of impulsivity, a lot of hyperactivity, and I'm not able to control, and which lands up into a lot of tantrums. Okay. So a normal child also can throw a tantrum. You would see a lot of children just crying in front of a balloon person. They wanted the balloon, and the parents are, no, we are not going to get you the balloon. And they're crying, they're lying down on the roads and just wiggling their way out. So the thing is that we really have to find out what the causative agent is. Once we have found out, so make sure that during the tantrum you don't give, you don't tell him don't do this, don't do this, don't give the gyan or don't give knowledge during the tantrum. It is something like, if you are angry with me and at that point of time I tell you, okay, you did this to me, you did this to me, you are wrong in that. Nobody is going to listen to that, because once you are angry, all your neurons stop working. So at that point of time, when the child is throwing a tantrum, just ignore. Take a deep breath, get to your maximum patience level, sit wherever you are, and don't even give a eye or a hearing to the child who's throwing a tantrum there. Because sometimes the tantrums are precipitated to get your attention. And if you will pay some attention, the tantrum the duration of the tantrum increases more. And if during the tantrum you're just relaxing like that, sitting and not paying any heed to it, then the tantrum duration would go down. And sometimes the frequency also goes down. The next is, after the tantrum is over and you are with the child in a good mood after that, maybe once the tantrum is over and you are going and taking the child for a sleep, at that point is the time that you tell the child, okay, you threw the tantrum and mama is not going to sleep with you tonight for next 15 minutes. So, a relationship would develop that because you threw the tantrum, so I am not going to give you whatever you liked most. So, once the child would get into that, okay, because I did this, I have been deprived of this, and so he would not do that. Similarly, once the child is throwing a tantrum, if you will not pay any heed, because a tantrum is only played to get something out of that. And if the child is unable to get anything, any benefit out of that, obviously the tantrum duration and the frequency would go, because he knows that in spite of throwing the tantrum, my parents are not listening to me. So that is not the right way to get the things done. And slowly, once it get drilled to his brain that this is not the right way, he would stop doing that. And obviously, you have to make sure that the antecedent incidences which happen have to be modified. So make sure that you know that your child, whenever he goes in front of the toy shop, he will really throw a tantrum. So make sure that you change the path. Make sure that whenever the toy shop is going to come, you take him in your hands and take him around, so that he doesn't see that toy shop or that balloon shop or blah blah, whatever the precipitating factors are. So again, and for that I need to know the diagnosis. Why? Because sometimes, as I said, the tantrums could be precipitated by a lot of impulsivity, or in ADHD children, or in children who have got intellectual problems. So in them, to explain the child becomes very difficult, that why you did this, and I'm not going to love you because you did that. So at that point of time, here comes the roles of the diagnosis. Because in that way, what we are going to do is, the ABA therapist is the one who's going to help you out. Because in in that way, what we are going to do is, like, if my child has got lesser of intelligence and he's not able to understand the relationship between of throwing a tantrum and the consequences, that I'm not going to get this, what we do is that we give direct thing. So once the child is throwing the tantrum, we say, okay, stop and take this. Whatever he wants, maybe a candy or whatever he wants to have, whatever his liking are. Stop, take this. Stop, take this. So in that point, again, that is a very direct and immediate casual relationship which I am explaining to the child, that if you will stop, then take this. Until unless he doesn't stop, you don't give this. So that is what you call as reinforcement for my better behavior. And these are all are explained by ABA. Also, you can see the video where I've elaborately described on whatever I've told you in short over here. Okay. So let's go to the next question, please. Palvit Yadav. I'm 4 years, 6 month old. I've been diagnosed with autism, and therapy is yes. My child is getting therapy from Continua only, Noida sector 71. My child stubbornness is increasing with age and shows tantrum while introducing task at work. So, Palvit, your question is, I suppose there was a second question or the third question which was exactly the same. And I've told like three reasons for that. That the aggression could be because I'm becoming more intelligent, I'm becoming more aware, I really don't want to do the things, or whether there is could be something hidden behind this diagnosis. This is like ASD with ADHD or not. Or third could be that I really am like, I really want to do this. And for that, to get this done, maybe I have to change the therapies to an ABA therapy, behavioral management, like I just said in the previous question, that could be introduced so that we could help the child in a better way. Over here, you also said that whenever you introduce the task at home, that is the precipitating factor. So make sure that you introduce the task in a fun way and then slowly increase the complexity of the task. You know, because at that, once you get the child and say, okay, now we will start writing, he may throw a tantrum that I am not going to write. That is not my piece of cake. अब मुझे नहीं पढ़ना, मुझे नहीं लिखना और मैं रोने लग जाऊंगा. But what you do is like, if you really want to make him write, so let's do what we want. Like we put the whole of my house with chart papers on the lower part of it. And what we do is like, we give paintbrush to the child and let him make that on the white chart papers, let him write. Because there the activity would be enjoyable. You would write, he would write, and that would be a fun activity in the big, a big space like thing. And as compared to children who don't want to write down in four lines between the lines. Or what you can do is like, you can, if you want to make him read alphabet and number, so instead of just putting that very monotonous book in front of him, what we can do is like, we can take him to different places and whatever is written in the surroundings. So you are taking him for a walk, just let him read your number plate. This is HR264929. Alphabet and numbers could be taught not only in the book, but while walking, running through different areas, to different places, through the hoarding, through your number plate, through your newspaper heading, through different places, your TV, whatever is written on your television, you can make him read that way. You have to find out the fun way activity of getting the task done. And once the child starts sitting on that, then you can increase the complexity so that he doesn't get the hint of it. So that is the small ways by which you can manipulate your child to work for the introduction of the task. Okay. So can we have the next question, please? Okay. Uh, so I am Naksh. I'm 3 year old. I have got autism and I'm taking OT. I'm taking speech. We are also taking medicine from last 1 year, but no improvement. Instruction, command following, not following, understanding issue and teeth grinding. देखो बेटा, I really need to know for the medications are we taking for. There are no such medication to treat the core symptoms of autism. And what are the core symptoms? Means your stimming, your sensory issues, your eye contact, your absence of response to name, or basically your lack of social and communication reciprocity is your non-verbal thing. There are no medication exactly to treat them. By giving medications, I cannot increase the social reciprocity of the child. So, I don't think so, because I don't think so that taking just medication would obviously affect. But yes, if my child, along with autism, has sensory concerns, if a lot of stimming, sleep issues, anxiety issues, constipation issues, those could be dealt by the medication. But if we are not looking for all these issues, then to treat the core symptoms through medication, obviously there won't be any improvement with those medications as such, because there are no medications right now which could really make my child improve on this. So I would really uh, ask in that work on a lot of OT. And if you think there are no sensory issues, go for ABA therapy, because you are telling I'm already 3 and I'm not following any command, I'm not taking the instruction, I am having understanding issues also. So I think rather than from speech, if no sensory concern are happening, can we go and change the plan to ABA therapy? Because I think that is what is going to help. Because if understanding is an issue, then making the child speak would be a difficult task just by taking speech therapy. I think we have to take a very comprehensive plan which covers up my autism, my understanding, my instruction taking, and all. And again, teeth grinding could be just because of my anxiety issues, my sensory issues. Maybe there could be some pathological problem in the teeth. So, for teeth grinding, those could be other things. I think OT and ABA would be a perfect plan for you. And obviously, medicines, no. Okay. So, can we go to the next question, please? That would be my last question. So, we'll be running up the time. So, नभ्या, मैं 3 साल 4 महीने के हूँ। वो बोलता है और समझता भी है और अपनी ज़रूरत की सारी चीज़ें बोलकर बताता है, लेकिन वो सामने नहीं देखता, आई कॉन्टैक्ट से बचता है, जिससे वो अटेंशन कम देता है और ध्यान भी नहीं देता। इसकी वजह से भाषा का विकास धीमी गति से हो रहा है, जबकि अकास्मिक और तर्क क्षमता उसकी उम्र से अधिक है। क्या ये उम्र के साथ खुद विकसित हो जाएगा या हमें अभी और प्रयास करने होंगे? देखिए, समय के साथ बेहतर तो ये होगा ही, क्योंकि बुद्धि अच्छी है और जो है अपनी ज़रूरत की चीज़ें बोलने भी लग गए हैं, समझदारी भी अच्छी है, तो खुद ब खुद तो ये थोड़ा बेटर होगा ही होगा, क्योंकि ये अपने सराउंडिंग में ऐसा नहीं है कि बिल्कुल भी इंटरेस्ट नहीं ले रहा, कुछ तो ले ही रहा है, बट उतना नहीं ले रहा जितना एक 3 साल 4 महीने के बच्चे को लेना चाहिए। तो मैं जो है आपको बोलूंगी कि जो है आपने होम थेरेपी करके इतना अच्छा बच्चा कर लिया है, इसका मतलब आप सच में बहुत समझदार पेरेंट है। आपने खुद ब खुद इतना अच्छा बना लिया है कि स्पीच भी आ गई है, समझदारी भी आ गई है। मैं चाहूंगी कि आप थोड़ा सा जो है अभी ऑक्यूपेशनल थेरेपी पे ध्यान दें, जिसके अंदर वो जो है जो एक्सरसाइजेज आपको बताएंगे कनेक्टिविटी वाली, एंगेजमेंट वाली, आप उस पे काम करें। या फिर सिंपल अगर जो है हम ऑक्यूपेशनल थेरेपिस्ट के पास भी ना जाएं और हम कांस्टेंट इंगेजमेंट करते रहें बच्चे का उन एक्टिविटीज के साथ जिसमें वो इंटरेस्ट लेता है। सो प्लीज जो है उसमें जो है चीजें आसान हो जाएंगी बच्चे के लिए, क्योंकि जो है जब वो इंटरेस्ट लेने लग जाएगा तो वो अपने आप सीखता जाएगा। आई थिंक आपने बहुत अच्छा काम किया। मैं नभ्या को बहुत अच्छे से जानती हूँ, मैं आपको भी बहुत अच्छे से जानती हूँ। मुझे पता है कि आपने बहुत बड़े सैक्रिफाइसेस करे हैं, आप बहुत दूर रहते हैं यहाँ से, फिर भी आपने बहुत अच्छे से होम प्रोग्राम, मेरी आपसे बात होती रहती है, मुझे याद है नव्या। आई थिंक आपने जो है जो आप कर रहे हैं वो बहुत बेहतर कर रहे हैं, बट एंगेजमेंट अभी आपको और करना है। मुझे पता है आप बहुत अच्छा एंगेजमेंट कर रहे हैं, बट थोड़ा सा जो है ये जो आप कर रहे हैं ये और करते रहिए, आप सही डायरेक्शन में जा रहे हैं। अगर आप यही करते रहेंगे तो आप डेफिनेटली आगे बढ़ेंगे। मुझे नब्या अब अच्छे से याद आ गई है, मुझे लग रहा है वही नब्या है। 3.4 ईयर्स भी मैच हो रहे हैं और आपने होम थेरेपी हाँ मुझसे पूछ के करी है। ओके, सो आई थिंक ये जो है हमारे क्वेश्चंस हो गए। अगेन रिक्वेस्ट है कि क्वेश्चन प्लीज जो है थोड़े से स्पेसिफिक कर दीजिए। बहुत वियर्ड और लूज एंडिंग क्वेश्चन से जो है हम आपको सही से गाइड नहीं कर पाएंगे, डिफरेंशियल्स नहीं बना पाएंगे, क्योंकि देखिए ये भी तो एक साइंस है। जैसे किसी बच्चे को बुखार आता है तो हम जो है ढूंढते हैं ये वायरल तो नहीं है, ये बैक्टीरियल तो नहीं है, ये डेंगू तो नहीं है, ये मलेरिया तो नहीं है उसकी वजह से बुखार तो नहीं आ रहा, ये टाइफॉइड तो नहीं है उसकी वजह से बुखार तो नहीं आ रहा। ऐसे ही जब हम जो है ये स्पेसिफिक कंप्लेन सामने रखते हैं तो हम उसके डिफरेंशियल्स रखते हैं कि क्या ये हो सकता है, क्या ये हो सकता है। तो बेस्ड ऑन दैट ये सारी चीजें होती हैं। तो अगर आप थोड़ा सा हमें और ज्यादा चीजों की जानकारी देंगे तो हम आपको वहां जड़ तक जाने की कोशिश करेंगे और आपको थोड़ा सा बेहतर आंसर दे पाएंगे। थैंक यू आपके क्वेश्चंस के लिए, और होप शायद हमने आपको कुछ हेल्प करी हो। अगर और आप जो है ऐसे क्वेश्चंस पुट अप करना चाहते हैं सो विल टेक मोर सेशंस, प्लीज पूछते रहिए ऐसे, और हम कोशिश करेंगे आपको जितने क्वेश्चंस का हम जवाब दे सकते हैं। थैंक यू सो मच फॉर पेशेंट हियरिंग। धन्यवाद।